Having a baby is a normal process, but it's also a painful process. We've talked a lot about different comfort measures that you can do, things like positions and yoga balls and massage or sitting in the bathtub, but there are also medicines we can use to help with the pain. Some of these medicines just take the edge off the pain, and other medicines really take some of the pain away. So let's talk through these different things that you can use. The first thing you can use is nitrous oxide, or laughing gas. And that's something that you control by yourself. It's a mask that we hook up to nitrous oxide, and you put it over your mouth and you just breathe in and out through the mask. It's a lot like the medicine that you might get at the dentist. What it's going to do is take the edge off the pain. If you think that nitrous oxide is going to take your pain away, it is not going to work well for you. What it's going to do is make you care less about the pain. And it works mainly right while you're breathing it in. That's the beautiful thing about nitrous oxide, is that it doesn't hang on for a long time. So you can try it. There's not a lot of risk to trying it, and see if you like it or if it's helping. Now, nitrous oxide isn't going to help you very much if you're 2 centimeters and you're hoping to get 2 delivered without using other medications, because it's going to help you right then when you're breathing it, and it's really not something that you're going to want to or be able to use for the next 10 hours of labor. It's going to get you through that little hump. So for example, it might help you if you're having some type of a procedure that's going to be more painful for a few minutes and you want to use nitrous oxide while that's happening. Or it might help you through the transition part of labor when you hit 7 or 8 centimeters and you're kind of at that breaking point, but you want something to help you to get to the next stage. Nitrous might be just perfect for you to breathe and use for a little bit. One of the things that's important to know about nitrous is you have to be able to hold it yourself. There's lots of things we can help you with and that your partner or family can help you with while you're in labor, but no one else can hold that mask for you. That's for your own safety. You need to hold it and breathe in and out, and then take it off when you've had enough and put it back when you want it again. So that's nitrous. The next thing that we can use is medication that can either be in an IV or injected, and those are narcotics. Narcotics also are going to help with the pain, but they're not going to take it all away. They're probably going to take off more of an edge than the nitrous, but a lot less than an epidural. We can use different types of narcotics. We usually use morphine or fentanyl. Morphine is going to last longer, it's going to make you sleepier, and we often will use it if you're having a really long early labor and you are exhausted and you just need to take a good nap. So we'll give you either some in the IV or an injection or a mix of those two and tuck you in for a good nap to hopefully wake up either more rested or in active labor, or just ready to go home after kind of a false start of your labor. The fentanyl is something that we give you in the IV. Fentanyl works for about 30 minutes, maybe an hour, and it's going to take the edge off, might make you feel a little dizzy. It might make you feel completely sleepy, and you'll fall asleep between your contractions and then maybe wake up or come to during the contraction and fall back to sleep. So once again, this isn't a really good option if you're 2 to 3 centimeters and thinking you want something for pain that's going to take you all the way to be delivered. But it will help you for things like transition, moving from that 8 centimeters to complete, or maybe if you have some sort of procedure after your baby is born or need a repair that's really bothering you, we can give you some fentanyl in your IV, and it's going to take that edge off. The thing about narcotics is they do cross over the placenta, and they're going to cross over to your baby, and they're going to make your baby feel sleepy just like you feel sleepy. Now that's not dangerous if your baby's not about to be born, because your body is going to process that medicine for your baby, and your baby will be just fine. If by chance your baby is born more quickly than we thought your baby would come, there are other medicines we can use to make sure your baby is wide awake enough to breathe and stay safe after they're born. The next option of medicine is probably what you've heard of most often, and that's the epidural, or the injection in your back. Epidurals are going to provide the best pain relief in labor, meaning if you're looking for something to try and take the most pain away possible, that's going to be an epidural. Epidurals are placed by an anesthesiologist, and what they do is they come in and they're going to place a small little tube in your back, and that tube stays there and gives little bits of narcotic that are around your spinal column, and it takes away the pain receptors from about right under your rib cage down to your toes. Now you're still going to feel pressure, but you shouldn't feel that same pain. So there are lots of good benefits and some risks of having an epidural. Hands down, an epidural is going to give you the best pain relief. And if you're having a long labor or a dysfunctional labor, or you're just at your wit's end, an epidural can be the very best thing to get you some sleep or some deep relaxation that can sometimes help a labor progress. But epidurals can also do the opposite. Sometimes if you get an epidural too early in labor, it really can slow your labor down. Or it can make your baby come a little bit crooked down into the pelvis if your baby's not low enough in the pelvis yet. A lot of women are worried about having damage to their nerves because they've heard that getting an epidural can do permanent damage to the nerves in your body. That is extremely unlikely. More commonly, the thing that might happen is you have the epidural placed and it has to be placed again because it's not giving you good pain relief. And that's frustrating when you're in labor to have to go through the procedure again. Secondly, about 1 in 100 women have a headache the next day. And that headache can be treated, but once again, it's irritating to have a strong headache the day after you had a baby. Like I said, we're going to call on one of our partners who's an anesthesiologist to come and place that epidural. You should know that from the moment you decide that you want to get an epidural, there are a few things that need to happen before you're going to get that pain relief, and it takes a little time, even if we're moving as fast as we can. The first thing is you need to get some IV fluids. We want to make sure you're really well hydrated before you have an epidural placed, otherwise your blood pressure can drop, and we don't want that to happen. So we're going to give you a whole bag of fluids before that anesthesiologist comes. We also might need to draw some labs depending on what's happening and how long ago we checked your platelets. And we would need to wait for those labs to come back. Once the anesthesiologist comes, the nurse is going to help you get in a position sort of sitting on the edge of the bed, and kind of like a mad cat or a shrimp, you're going to push out the middle of your back towards that anesthesiologist when they arrive. They're going to clean off your back. They're going to feel where the best place is to put this. Then they'll put in some local numbing medicine, which kind of burns and stings, but that will make it numb back there. And then they'll use another needle to place that little tube I was talking about that's going to stay. And then all the needles come out. So the needles are in your back for a very short period of time. And then this tiny little tube that's flexible will stay there that they'll tape in place. And that's what they're able to give you medicine through until your baby's born. So you're able to have that pain relief from the time that it's placed until after your baby's born when we pull out the tube. It takes about 15 minutes or so after you're all done getting the epidural placed to have some amount of pain relief. Now, some people after they have an epidural still feel quite a bit of pressure but not the pain, and other people feel nothing at all. We actually like when you can feel a little bit of pressure because it makes it easier to push. If you have no sensation at all, it can be a lot harder to push with an epidural, but that's okay. We allow for more time because we know it's going to take a little bit more time when you have an epidural to push. There are a few things you should know after you get an epidural. Once you've decided to get an epidural, you're going to need to stay in bed after that epidural is placed because we just don't know how strong your legs will be and we don't want you to fall. So just to know that once you get an epidural, that's sort of deciding that you're going to stay in the bed until after your baby is born. You'll be able to walk again a few hours afterwards after we pull out the epidural. That also means that you're not going to be able to use the bathroom. Oftentimes you don't have that sensation in your bladder anymore, and so we'll need to put a tube or a catheter in to keep your bladder empty because we want to keep your bladder as empty as possible to make all the space for the baby's head to come down.